and see how far it gets. Thank you so much.
And Samina, you've got the thing in your packet, is National Director of Policy and International Health, World Health Organization, Collaborating Centre on Investment for Health and Wellbeing, Public Health Wales. And she is going to talk about health inequalities, the cause of causes.
Thank you. Thank you. First of all, can I say what an honour it is to be here? So when I had the invitation, I saw health inequalities and I got really excited. And then I saw women and ethnic minorities and I got even more excited, which is why I'm here. So thank you so much. It's such a brilliant opportunity to be here. Now, before I start, I just wanted to say that Public Health Wales is a national organisation and we are one of 10 health organisations in Wales. We exist to help people live healthier and longer lives. This is for now and also for future generations. And tackling health inequalities is at the core of what we do. So, I first of all wanted to start off talking a bit of stats, because I love stats, I love a good graph. Now, for people under the age of 75, 3/4 of deaths are avoidable, okay? Now, of those, you've got preventable deaths and treatable deaths. When you look at preventable deaths, so that's the graph on your left-hand side, those are deaths that could be prevented from public health interventions, from early intervention. Now, what you'll see is 2 lines. The top line is for those from deprived communities, the most deprived communities, and the bottom turquoise line is from the most affluent communities. And what that shows is if you're from a deprived community, you're twice as likely to die from a preventable death. Grossly unfair, as many of my colleagues have said earlier. And when you look at treatable mortality, so these are deaths which are due to deaths from not being able to access healthcare quickly, or perhaps not to the effectiveness that it could be. We still see that gap, okay? We still see a gap between the most and the least well off. Now, what I also want to talk about is the gradient in healthcare access. So what we've got here is a graph showing use of healthcare. So this is health hospitals in particular, by different people in different communities in Wales. So on the left-hand side, you have a graph, and what it shows is different hospital services, okay? And on the left side of that is people from affluent communities, and as the line travels to the right, those are communities that are getting more and more deprived. And what you see is that the slope's sometimes going upwards. And that means that more deprived communities are accessing certain types of healthcare. So we are talking A&E services, we're talking emergency admissions, we're talking admissions due to maternity reasons. And that also translates through to costs in the health system. So somebody mentioned earlier that inequalities cost, and they do. So we've done a piece of work trying to actually cost what it means to hospitals in Wales, and that figure is 322 million in Wales alone, and that is 8.7% of hospital spend. That is huge if you think about it. So not only are health inequalities unfair, they cost an awful lot of money. So who are we thinking about when we talk about inequalities? Who's affected? And in public health, we traditionally talk about geographical inequalities. So what we do is we look at concentrations of deprivation. And by deprivation, we don't just mean low income, that is one marker. But we also mean things like access to services, the housing, the employment. So it's multiple parts of deprivation that are pulled together. So what this map shows is how deprivation is spread in Wales. And some of this will be familiar to you, the heads of the valleys around the big cities. But what it doesn't show is sometimes deprivation is spread out. So particularly in rural areas, this map won't show it. There are other ways of looking at inequalities though, and one I am particularly interested in is income poverty. So this is households who live in poverty, who live 60% below the average UK household income. And the graph on the left basically shows it by age group. And it's really depressing. And it's depressing because it's showing that children are the most likely to be affected by income poverty. So currently in Wales, 28% of children live in poverty. We're in a first world country. You know, that cannot be right. And then when you look at housing, people who live in social rented sector are more likely to live in poverty. So half of people living in social rented sector are in poverty. And when you look at family type, if you are a lone parent, you're more likely to be living in poverty. 40%, 4 in 10 live in poverty. And that equates to 80,000 children living in households that are in poverty. That's a huge number just in Wales. And disability is another axis. And what this graph shows us is basically whether you are a child or an adult, if you have somebody in your household with a disability, you are more likely to be living in poverty. I found this report quite recently, and I'm sure many of you are aware of it, but I really liked it because what it did was it looked at well-being in Wales with an ethnicity lens. And it's well worth a read, and there's so much in there, but I just picked out a few snippets because I think it's so important. So first of all, if you're from Black, Asian, minority ethnic group, 40% of us will live in poverty, and that is nearly twice those living in white ethnic groups. Okay, that description hides an awful lot of variation, but it's still a terrible figure. And you're also more likely to be living in material deprivation. So that means the living conditions of your world, so the house you live in, whether you can afford to eat, all of that. And you're less likely to be keeping up with bills. And there's a pay difference gap. So if you're from an ethnic minority, each hour you will get paid £2.23 less. That is really quite stark and shocking. So there's so many different ways of piecing all of this together. You know, how do you hold all of that in your head? All those different intersections of ethnicity, deprivation, gender, poverty, you know, how do they all come together in health inequalities? Now, when I think of health inequalities, I tend to go back to this graph because, okay, it's a bit complicated, but it kind of draws out some really important things. So what it does is it first of all looks at, well, what are the initial causes of poor health? And then what it does is it takes a step back and looks at what are the causes of those causes. Hence why I'm talking about the causes of the causes, because that's what interests me. So first of all, you know, we all know our genes contribute to health. We had a really good talk earlier. It was fascinating, you know, about genetics. And then we all know, you know, whether we smoke, what we eat, you know, whether we drink alcohol or not, you know, that affects our health. We're increasingly understanding that our homes affect our health. The air we breathe, whether it's polluted, that will determine whether we, you know, become sick or die. What this illustrates is actually you can take it a step further and think further back. And those are often determined by our socio-economic position. So hierarchies that we see in society. And that's according to our class, it could be our gender, it could be our ethnicity, and all of that is affected by our education, our jobs, what we earn. And none of that is in a vacuum, because if you take it a step further back, it's all of our values, you know, as a society, and it's also all the policies that we have and the infrastructure. All of that comes together to determine our health and also affect health inequalities. So if you really want to tackle health inequalities, you've got to think across all of that, not just at things like smoking. Of course you've got to do that, but you've got to think, you know, well, why do people smoke? What is it? What's the conditions that put them there? So this is something that has been developed more recently by the World Health Organization, which is something called the 5 essential conditions. And what they try to do is measure how much do different bits of our lives contribute to our poor health. And don't worry about the figures, it's not important. It's kind of a bit of an illustration. So what they found were 5 things, 5 essential conditions that contribute to health inequalities. And these are health services, income, our living conditions, employment and our working conditions, and social and human capital. And the key thing I wanted to highlight here is health services is in red. And that is the smallest bar, okay? And basically it's saying that's not what's contributing to health inequalities, it's everything else. It's our employment, how much we earn, all those conditions. That's what we need to be thinking about. And I can't talk about health inequalities without briefly touching on COVID, and somebody's already talked about that, so I'll be really quick. But basically, COVID arrived when we already had health inequalities. So it's landed, we had those health inequalities, and it made things worse. Yes, it directly harmed health, but if you think about it, the indirect harms were huge. It affected people's ability to go out and work. It put certain groups at risk. People who were more sick, more likely to die, were those who were often poorer, the most vulnerable in society. And then following on from COVID, we had the cost of living crisis. And we had, for 2 years, 3 years now, it's been in the news, it's faded from the news. But if you remember, we had high inflation, and that is now baked into costs, even though we may not talk about it. And the cost of living crisis affected every aspect of life, and it affected all of us, but it didn't affect us equally. Again, like COVID, it opened up the gap between people from different backgrounds, with different earnings, with different resilience. It's affected people's ability to eat, to heat their home, to pay their bills. It's had huge implications. It's more than an economic problem, it's a public health problem. And my concern is that even though it's faded from the front pages of the newspaper, it's having a long-term impact on our health and also future generations' health. I just wanted to very quickly mention a project that we've been doing a couple of years, which is looking at whether people can keep warm in their own homes. And we've done a couple of surveys before COVID and during COVID. Very quickly, nearly half of those in low income are saying that they are stressed, anxious, worried about paying bills, keeping warm, heating their home. People who have disabilities are 3 times more likely to report that they are feeling uncomfortable because of the cold in their home. We've heard people tell us that they can't eat healthily, they dare not use the oven because of the costs, and they've cut back on bathing, so hygiene poverty as well. I think what this does is illustrate how we can't think of health, the economy, and our living conditions separately. We've got to look at them all together. Now, if we want fairer health for everybody, we want to tackle health inequalities, the evidence shows us that the impact and where we've got to focus is upstream, okay? So, yes, you need to tackle health inequalities by looking at treatment and care. You've got to look at behavioural aspects. You've got to look at psychosocial factors, people's living conditions, but you've also got to look at the structural determinants of health. That's where the evidence is. And that is also where we will get the greatest value for our money as well. If we invest upstream, rather than reacting, we can tackle health inequalities, and that is where we will get the greatest value for our money. So I just want to take the opportunity to very briefly talk about a few things that I think we've got going for us in Wales, and also just a few examples of our work. So to tackle the causes of health inequalities, we need to think about things together. So I talked about living conditions, income, talked about people being able to afford food, None of that happens in isolation. It's all interconnected. So that means we've got to think about these problems and solutions in an interconnected way. And I look to the Wellbeing of Future Generations Act to help us do that. So I view this as a landmark piece of legislation. And it means that public bodies, so that's local authorities, all of us in the health sector, so many of us need to think about how we are going to achieve a healthier Wales and a more equal Wales, amongst other things. And it also means that we need to work towards preventing ill health and preventing problems from occurring. So I view this as absolutely fundamental first step in helping us on that journey. I can't not mention climate change, and the reason why is because the WHO says it's one of the most significant threats to global public health. And not only that, it's affecting us in Wales, and it will continue to do so, and it will not get better. So this, for us as an organisation, Public Health Wales, this is one of our 6 strategic priorities. That is the importance we are placing on this. And this is just an illustration of some of the work we are doing. So it's an infographic, and it basically shows how climate change is already affecting us in Wales. And what it's doing is it's affecting the conditions for our health. So whether we live in a safe environment that may or may not get flooded, but it's also affecting different population groups differently. So for example, people are more likely to be affected: children, older people, people on low income, those with disabilities or with long-term conditions. It's multifactorial. The other thing I'm really passionate about is housing and health. And we've been working on this agenda for so many years. And what it does is it brings our living conditions together with people, with communities. It's kind of the nexus where everything comes together. When we think of homes, you can think of it as a commodity, but actually the United Nations looks at it as a fundamental human right. It not only keeps you warm and safe, it's somewhere where you connect with your community, it's where you have the infrastructure, it can help you in terms of your health, but it can also be a source of poor health as well. We have a vision where everybody's home helps them live longer and healthier. So homes need to be affordable, they need to be right for the people that live in them. They need to be in communities that help them live flourishing lives. So I've talked a lot about the upstream stuff, and that is not to say that we shouldn't look at health services and what they can do to tackle inequalities, because actually we need to use every lever open to us to tackle health inequalities. And we've got policies, that help us make sure that services are effective, they're accessible, they're safe. But the other things we need to do are use all the tools. So, for example, health impact assessments help us understand the impact of our decisions, our actions on different communities, and it helps us identify who might be disproportionately affected. Health needs assessment is a classic but important public health tool. And what it does is it helps us understand where the health needs are, where we need to focus our energies and our health services. And economic assessments are actually really important because they make sure that we use public money to the best effect. And there are practical examples of, right now we have backlogs with healthcare service access, we know that. But there are practical examples of, even there, we can think about, well, how do we tackle inequalities? How do we use data about backlogs to actually work out, well, who's on that waiting list? What support do people need to access services so that we have better outcomes for everybody? So I want to finish with a solution, something helpful. So Public Health Wales, along with Welsh Government and the World Health Organization, have collaboratively developed a health equity solutions platform. And what we have here is a tool which includes policy solutions, it includes data, it includes health economics, it includes information about vulnerable groups. and it's got downloadable information to try and help people make better decisions to tackle health inequalities. So thank you so much for the opportunity to talk. Really enjoyed it and really happy to take questions afterwards.
Thank you very much, Serena. And we will be having the questions after all the speakers have spoken. But we are going to have a interlude. And Mina, can I